Joining us now to talk more about social media and its impact on children's mental health is Dr. Heidi Rollings with Pine Rest. Thank you so much for being here with us. So you have published research on this exact topic. What have you found when it comes to social media and children?
Yeah, well, we do know that there is an intersection between teens' mental health symptoms and their media use, but a lot of it comes down to content, the types of experiences that they're having online, and how problematic their media use is. And it's fairly nuanced. We also know youth have positive experiences online and find community. A lot of their social development is happening alongside their media use. So it can be really tricky and hard to untangle, but we know that not enough clinicians are trained to understand these effects, to ask about it, and some of our research is looking at getting more tools for clinicians, for social workers, for pediatricians, for families, and youth themselves so that they can have healthier online use patterns and improve their well-being online and minimize some of their ill-being online.
What's your best advice for parents, when it comes to social media and their children?
Yeah, I think being more curious about their online experiences, both the good as well as the bad, trying to take a look at, how is use happening in the home? Is it crowding out important times that should be prioritized for a child's functioning, like meal times or sleep times? Are they noticing changes in their child that might look not great for their functioning, not attending school in lieu of using devices, or not sleeping as well, or not eating, spending a lot of time? And I really think parents should be asking more about their online experiences. What made you feel uncomfortable or not so great in what you did today online?
Just having those conversations for sure.
Absolutely.
I did want to talk about this, Dr. Rollings. You are the medical director of the Pediatric Center of Behavioral Health.
Yes.
That is opening next month. Talk more about that.
Right. Yes, well, in March, we're launching our Pediatric Center of Behavioral Health. We have a lot of different programs available, outpatient. We have inpatient, 66 inpatient beds. We have an urgent care where families could walk in crisis in the moment and get help. And we have a lot of family resources and support to ensure they get to the right programs and the right supports that they need as well.
Absolutely. Anything else that you wanted to share about, social media right now for parents and children right now?
Yeah, well, we certainly have a lot on our website that parents can direct it to. It's at Pine Rest website. It's youth and social media. We have some training videos on there. We have collected a lot of national databases on the research, as well as tools and kits and things to help families and youth.
Dr. Rollings, what is that conversation like, though, when, you do have a teen who is struggling, right, and they come for help? What does that look like?
Yeah, well, I think it's setting the stage for understanding what is going on, how they're experiencing their online digital world. There are tools that we can use that help understand a little more what we kind of think through that addiction lens of how are they using? Are they using to the point of no longer enjoying other things? Do they have a hard time putting down their devices? Are they using it in place, again, of those important functions like sleep, time with friends, time off of digital use? So there are tools that can assist in those conversations if you don't know how to have them organically.
Yeah, absolutely. This is an important conversation for sure. Dr. Rollings with Pine Rest, thank you so much for joining us.
Thank you for having me. I appreciate it.